Good morning. Morning, Governor. Morning, everyone. Earlier this morning, we announced several actions to combat COVID-19 in the Commonwealth. The Massachusetts National Guard will once again answer the call to assist residents. Hospitals across Massachusetts are experiencing an unprecedented demand, and there remains a critical staffing shortage in many jobs and many roles to meet the needs of our patients. We're committed to ensuring our healthcare system meets the acute care needs of our residents. To support hospitals that are experiencing staffing shortages, the Governor is activating up to 500 members of the Massachusetts National Guard to ensure sufficient non-medical personnel are available to deliver support to patients. This will allow hospitals to free up clinical staff to provide higher levels of care to those who need it. Beginning with training this week, 300 of these Guard members will support 55 acute care hospitals as well as 12 ambulance service providers to address the non-medical support needs of our hospitals and transport systems. They will be on site Monday. These non-medical Guard personnel will serve in roles such as non-emergency transport between facilities, like transporting a patient from a hospital to a nursing home, assistance transferring patients between bringing the patient being discharged from a hospital to a nursing home. Patient observers, providing continuous or frequent observation of a patient who is at risk to harm or themselves. Security support to help maintain a safe workplace. In-hospital transport, bringing a patient via wheelchair or, if needed, a stretcher from their patient room to tests such as x-rays or a CT scan, or from the emergency department to their inpatient floor. And food service, delivering patient meals. Additionally, to further address the critical staffing shortages in our hospitals, the Department of Public Health has released updated guidance to hospitals regarding non-essential elective invasive procedures. Effective 12:01 a.m. on December 27th, all hospitals are directed to postpone or cancel all non-essential elective procedures likely to result in an inpatient admission in order to maintain and increase inpatient capacity. I want to be clear, our hospitals remain ready to care for the urgent needs of the residents of the Commonwealth. In response to the rise in cases and hospitalizations we are seeing in the Commonwealth, and as we learn more about the emerging Omicron variant, the Department of Public Health advises that all residents, regardless of vaccination status, wear a mask or face covering when indoors and not in their own home. We particularly urge this recommendation if you have a weakened immune system or if you are at increased risk for severe disease because of your age or an underlying medical condition, or if someone in your household has a weakened immune system, is at increased risk for severe disease, or unvaccinated. I know we are all feeling the pangs of pandemic fatigue, but as we all prepare to gather with our loved ones, a tradition long overdue and has been interrupted by the COVID-19 pandemic, it's important for all of us to remember that the vaccine and boosters are highly effective at protecting against serious illness, hospitalization, and death. The best possible gift you can give to your loved ones this season is protection from COVID. Get vaccinated, get boosted, and have a safe holiday. Thank you. With that, I'll turn it over to the Governor.
Thanks, Secretary. To the Massachusetts healthcare community, to the doctors, nurses, technicians, specialists of all sorts, and every person who reports to work in a healthcare setting, thank you on behalf of the people of the Commonwealth of Massachusetts. You're working in wildly challenging and difficult times and circumstances. What we announced today will hopefully allow you to serve your patients more effectively. The Massachusetts National Guard is also due a tremendous thank you. From getting kids to school to protecting small businesses to now helping our healthcare providers, these citizen soldiers answer every call. The jobs and commitments they leave to serve us, I'm deeply grateful for it. There's no question the next few weeks will be enormously difficult for our healthcare community. There are staff shortages, sicker patients, and fewer step-down beds available, again, because of those staff shortages. The steps we're announcing today are designed to support them so that they can continue to care for patients. We also know there's some anxiety out there with talk of rising cases, breakthrough cases, and variants. Throughout the course of this pandemic, there's been no shortage of hypotheticals, no shortage of worst-case scenarios to be debated, and no shortage of things we don't yet know the answer to. And it's very easy to get lost in all that. It's also easy to get anxious about all that. But it's critically important that we also remember what we do know for sure. We know that kids are at extremely low risk, and we know that going to school is safe, and in many cases, it's also healthy for children to be with each other and with trained, caring adults. We know vaccines work. We know that out of the 5 million people in Massachusetts who are fully vaccinated, only 2% have gotten COVID. We know that among all the breakthrough cases in Massachusetts, 97% of them never end up in a hospital. And we know that of the 1.2 million people over the age of 12 and under the age of 30 who've got vaccinated, not one has died from COVID. We know that of the nearly 2.5 million people under the age of 60, less than 1% of these people, in fact, 0.1% of them have died from COVID. And we know for those over 60 who got vaccinated, less than 3% of them have died from COVID. And we also know that almost 2 million people in Massachusetts have already received a third dose. We also know that unvaccinated people are 31 times more likely to just test positive than someone with that third dose. We also know that the vast majority of the people in the hospital with COVID are not vaccinated. All that means, among other things, is that we know for sure that vaccines offer tremendous protection from illness, better than any other measure. We also know testing works. Rapid at-home tests taken before you get together with people outside your household can prevent transmission. They offer a little more peace of mind this holiday season, too. And the hundreds of testing sites around the state can do the same. We also know wearing a mask can help. If people want to take an extra step, everyone knows they can put on a mask in a crowded indoor place. We updated the face covering advisory today to urge all residents to wear a mask in public indoor spaces. We'll continue to release the best public health directives we have so people can make informed decisions about how to protect themselves. Obviously, our administration will continue to support cities and towns and businesses that adopt additional protocols. Vaccines and all the other resources we now have available and know for certain that they work are far more important than any hypothetical question that we may not yet know the answer to. For the foreseeable future, Massachusetts and most of the country will see large numbers of new cases. But a new case today does not mean the same thing a new case meant a year ago. The therapies and vaccines that offer near universal protection did not exist a year ago. Vaccinated people may test positive, but their chances of dying or getting seriously ill are so small they pale in comparison to so many riskier behaviors out there. We should not lose sight of this. Yes, cases may go up, but if you're vaccinated, your risk stays the same. That is extremely low. And if you're boosted, your risk of getting sick is even lower. The holiday season is here, and opportunities to share special moments with people we love are also here. The people of Massachusetts sacrificed those moments when hunkering down was truly our only defense. That's no longer the case thanks to the protection afforded to all of us by vaccines. Getting vaccinated and getting a booster, if you're eligible, is the best thing you can do this holiday season for you and your family. Doing so will help you and your friends and family because it is the single best thing you can do to support yourself, your family, and our healthcare providers. We distributed over 2 million free rapid tests for people here in the Commonwealth in many of the communities hardest hit by COVID. Those tests are also available at retail, at your local pharmacy, at many other locations, and you can also purchase them online. Use them before you get together with friends and others. Let me say that again. You can buy a cheap do-it-yourself test at CVS, Walgreens, Walmart, or online, and use those tests before you get together with others in big groups. In addition to at-home tests, our testing sites in Massachusetts continue to be available and are very busy, delivering over 100,000 tests a day for the past several weeks. The testing tools, vaccinations, and many of the other tools we have make it possible for people to gather safely. We just need to use them and use them appropriately. It's no secret that all the time we spent away from family and away from friends and away from the classroom had a negative impact on some of us. But back then, it really was our only defense. The Commonwealth is home to strong and intelligent people, but no one is immune to the anxiety and the mental health struggles that have been brought on by all this isolation and loss of physical presence that has come with the pandemic. Please, if you're struggling, reach out to a friend or a family member or reach out to a healthcare provider. If you know someone who you think may be struggling, reach out to them. They are sure to appreciate it. And please get your information about COVID from a trusted source like your doctor or a medical institution or the Department of Public Health or your local Board of Health. And to all of the people in Massachusetts who have done their jobs throughout the course of this pandemic, we need you to do another one, to be there for your friends and your family and to offer a helping hand through the course of this holiday season. People are anxious. That's normal given everything we've been through. But what we know about this virus, what we know about how to protect ourselves, and what we know about the character of the people in Massachusetts should give us all cause for pause and a sense of relief. Thanks to so many people, Massachusetts is one of the most highly vaccinated states in the country, and the evidence is overwhelming that these shots work. We've made tremendous progress by doing the things that Massachusetts knows well, following the data, looking out for one another, supporting one another, and being there for family and friends. That game plan is working, and we should stay with it. And with that, questions for me or the Secretary?
Pointed out, Massachusetts is National Year of Vaccination. So, do you think that we would be back here, and where did we go wrong?
Well, I don't think anybody went wrong. As I said, I think Massachusetts, more than most, has done almost all the things that make sense to protect themselves and their communities over the course of the pandemic. But as we've all noted, the virus has gone through a series of changes and variants over the course of the past 2 years, which has absolutely changed along the way the game plan that we and others have employed to support our communities and to keep our people safe.
Governor, by putting out the advisory that say regardless of vaccination status, you can mask up, there's an indication that obviously more needs to be done. Why stop short than a mandate, even if there's a recognition that, there needs to be an increase in masking, that people should, more people should be masking?
Well, we are saying that we think more people should be masking, but people in Massachusetts know at this point that masking is one of the tools they can pursue if they choose to do so to protect themselves. But let's not forget, 5 million people in Massachusetts are fully vaccinated, and the vaccines are by far the most effective tool we have in the toolbox to protect one another from COVID.
Do you have the power to issue a mask mandate, or do you need to declare another state of emergency to be able to do it? I mean, is it in your power to order a mandate right now?
I have no interest in putting a mandate on this issue, given all the tools that are available on a statewide basis on the people of Massachusetts. If locals wish to pursue alternative options, they can do so. We issued a mask mandate last fall because we had no other options available to us. At this point in time, we have vaccines, we have rapid tests, we have our testing sites, and people know a lot more about what works and what doesn't with respect to combating the virus. And if people wish to add an extra layer of protection by wearing a mask in indoor settings, we would urge them to do so, especially when we have cases rising across the Commonwealth.
What about schools? Is there any possibility that they could shut down again? Will changes have to be made after students return after the break coming up? And what will the mask policy be for schools? Or I guess, is there any?
Well, DESE has a mask policy in place at this point in time, which they continue to discuss with their colleagues in local government and with leaders in the medical community. My view on this one's really simple. Kids need to be in school. School is safe. It's not only safe, it's healthy. There's an overwhelming amount of evidence out there at this point in time that keeping kids out of school, keeping them away from one another, keeping them away from trained and caring adults did terrible damage to kids all over the country. It's not going to happen in Massachusetts.
Governor, are you able to give an updated number on the number of cases of Omicron in the state at this time?
We follow, for the most part, the cases in total that we process every day. There are many people sequencing these cases. I think what the fair thing to say is Omicron is clearly going to become the most significant variant here in Massachusetts, if it's not already, soon.
Do you plan on issuing Omicron-specific numbers?
We've never issued Delta-specific numbers. I don't know why we would do that with Omicron.
Only the first cases, yeah.
Only the first cases? Okay.
Governor,
Do you see any from field hospitals at all coming back?
Do you want to talk about how the Guard's going to assist hospitals in this one?
So what we're pursuing with our hospitals is by providing, think of it as like giving hospitals the tools to expand, to maintain and expand capacity within their own footprint. We've lost 500 acute care beds in Massachusetts because of staffing shortages. So by providing the non-medical side of the core, will hopefully allow them the capacity, the ability to open up additional beds. The challenge with field hospitals right now across the country is the staffing shortages
And the sites.
and the sites.
So I can already see the comments online. How do you respond to people who say the staffing shortages are due in part, of course, people leaving the workforce, but also because of vaccine mandates? How do you respond to people who say if there wasn't a vaccine mandate for hospitals or clinics, there wouldn't be the staffing shortage, we wouldn't need the National Guard? How do you respond to, again, those comments that could already imagine saying?
I would argue, I mean, based on the conversations you and I have had with the hospital community generally, I think they would say that the staffing shortages are something that started before anybody was putting mandates in place. And the two other things I would say, and these are really important, a staff member who gets sick can't work. A staff member who stays healthy can work. And more than anything, we need our colleagues and our friends and our neighbors who work in the healthcare community to be safe and healthy because of the work they do, not just with COVID people, but in general throughout the course of this particular time of year, which has always been, as far back as I can remember, a point in time when you see significant more traffic in our hospitals than you would see at other times of the year.
Governor, to clarify the National Guard, 300 are training this week to be deployed Monday. Why, then when will the other 200, you say up to 500, when will the other 200?
Part of that depends on what we hear from the hospitals, but you can speak to it if you want.
So the today's order of up to 500 includes the immediate 300 for hospitals and ambulance companies. It also acknowledges the other about 80, 85 that are currently deployed for school testing and other testing support. Command center staff, so the Guard has to bring in staff, the administrative staff, to actually manage the deployment of the 300 plus, and then just literally like an extra amount to deploy as we need. So it's 380 to 85 that are already deployed or part of this order. The staff that the Guard needs to just administer the program of deploying 300 people across hospitals and managing them, plus the 12 ambulance companies, and then literally just having like an extra amount if we need to further deploy.
Was that the 100?
Yeah, right. So 300, 385 plus another probably 50 to just manage the whole logistics, and then, so that's probably another, all right, somebody else can do the math. So the training happens by both the Guard and the hospitals. So they'll have basic CPR training, basic EMS training, and then the hospitals will do their own internal training for the particular role that they have.
Governor, the holidays are a time everyone looks forward to getting together. Many people feel like they've already missed out on a couple years of spending time with family and friends. How do you stress the importance of getting that test ahead of time, and then if you do test positive, to quarantine and maybe remove yourself from the situation?
So one of the main reasons we went outside the traditional procurement routes to make a deal with a single test provider and to bring 2 million tests here to Massachusetts, to many of our hardest hit communities, was because we wanted those rapid tests to be available in those communities to help people stay safe and to test themselves before and after they involve themselves in gatherings. And part of the reason we wrote a contract with a number of these testing organizations to make it possible for cities and towns to start buying off that contract and using some of their federal money to do so was to enhance and continue to replenish the testing supply that's available in communities around the Commonwealth, to go along with the 100 sites we have that currently do about 100,000 tests a day, and to go along with all the tests that people might be able to find at a retail level or to purchase online. I think it's part of the reason why the President's talking about a major test purchase on the part of the federal government as well. Because this is in many ways one of the best ways people can test themselves and those they would gather with to be confident and comfortable that they can have a safe holiday gathering. And it's for many reasons, including the one you spoke to, which is the fact that for so many people, these events have either been canceled, postponed, or dramatically altered over the course of the past couple of years, that we really want people, especially those who are vaccinated and especially those who take advantage of these tests, to be able to gather with confidence that they can gather safely with the people that they love.
There's been such a high demand for tests, especially with the holidays coming up. Is there any plan to expand testing sites in Massachusetts and increase availability in any way?
Well, as I said, we're doing about 100,000 tests in our own sites. We put 2 million tests out into communities, mostly those communities that were hardest hit by COVID in the first place. We're going to continue to make it possible for people to buy off those blankets on a go-forward basis, and we're going to do everything we can to make as much testing capability as available as we can. We get the fact that at this time of year there's going to be heavy demand on them, which means people may have to be patient and to wait. But that testing capacity is a critical piece, we believe, of our strategy to help people stay safe.
Governor, do you approve of the plan Mayor Wu rolled out yesterday to require vaccinations in public places?
Well, we've said many times that we believe it's critically important for us to work with our colleagues in local government on whatever initiatives they pursue that they think will be most helpful to them and their communities. I guess what I would say is that if there are ways in which we can support the city of Boston, I mean, they were a big winner on the vaccine rollout, or excuse me, on the testing rollout. They got almost 500,000 rapid tests from us. We'll certainly work with them and any other community on any initiative where we can be helpful.
That is the kind of step that you would approve of a municipality taking.
I don't want to get into a business of telling municipalities what to do and what not to do, okay? What I want to do is be here to help them if they seek our help on initiatives that they pursue.
Is the decision to shut down those non-essential surgeries at a hospital a proactive move by the state, or is that something that the hospitals they were asking the state to shut them down?
You should, I mean, I would argue that this is an iterative conversation that's been going on with them for 2 years, basically. But do you want to speak to that in particular?
So we've been meeting with the hospitals, it was daily during the early days of the pandemic, and it continues on a weekly basis. We've had a lot of back and forth around the acute care staffing shortages that exist in the hospitals, and put on a series of items that we went back and forth together. The Hospital Association put on a number of items, we put on a number of items, and literally everything from the ICU nurse staffing flexibilities to using alternative space for procedures and the like to the non-essential electives, and allowing also for individual hospitals, if they maintain 15% of capacity, right, they would be allowed to continue the electives. So it's really been a very iterative process back and forth with the Hospital Association.
Thanks, everybody.